This video contains information that will help you to have a safe recovery during your stay in hospital. Thank you for taking the time to watch this video. Chapter 1. Falling over in hospital is a big problem. Up to 1 in 4 people fall over while in a hospital ward like yours. 1 in 3 falls leads to an injury, like a bruise, cut, bumped head, or broken bone. Chapter 2. 3 simple steps to stopping falls. Step number 1. Know if you need help to get up and walk around. Being unwell or having had surgery means that you are not likely to be as good at getting up and walking around as you normally are. Even people who think they are safe can still be very unsteady. Ask your nurse or physiotherapist how steady they think you are on your feet and how much help they think you need to walk around. Step number 2. Ask for help. Please do not feel embarrassed to ask for help, or that you are bothering the nurses if you do. It is normal to need help to do things like get out of bed and go to the toilet when in hospital, as you are still recovering and getting back to normal. We are here to help you do these things while you recover. Press the nurse's buzzer or just ask for help when you need it. Step number 3. Wait for help. Many people have fallen over even though they asked for help. This is because they did not wait for help to arrive. Although we want to be able to help you as soon as you ask for help, there are many other patients on the ward who also need our help. This means that you may have to wait a while for us to help you. Even if you need to do something urgently, for example, if you need to go to the toilet, you still need to wait for help to arrive. Your risk of falling over and hurting yourself is much greater if you do not wait for the help you need. Chapter 3. When, where, and why do falls happen in hospitals? Part 1. When do falls happen? Falls can happen at any time of the day or night. There are lots of falls in the morning. This is a very busy part of the day for patients and nurses. There will be some patients who need a lot of help to eat breakfast, go to the bathroom, shower, and get dressed. The nurses will often be busy helping these patients in the morning as well as trying to help you. This may make it hard for your nurse to answer your buzzer straight away. Not many falls happen at lunchtime, when people are sitting down eating their lunch. There are lots of falls in the afternoon and early evening. You may feel quite tired in the afternoon, and this can make you more unsteady than usual. Nurses may also be busy in meetings and writing notes. Not many falls happen overnight. This is because most people are asleep in bed. However, some falls still do occur. So, it is important to ask for help and to wait for help if you need it to go to the toilet. Part 2. Where do falls happen? Falls can occur in many places in a hospital. In passageways, in the bathroom and toilet area, in the shower, and by the bedside. Patients we have asked think that most falls in hospitals happen in the bathroom. They also think that if they were going to have a fall, they would fall in the bathroom too. However, 2 out of every 3 falls in a hospital happen by the bedside. If you want to avoid falls, think about what you do or want to do around your bedside. Part 3. Why do falls happen? Falls can happen because people get up and try to do things like reach into a closet, get dressed, or walk to the toilet. Trying to do these things is not wrong. The problem is that many people in hospital are unsteady and cannot do these things as safely as they normally do. That is why it is so important to ask for help and to wait for the help to arrive. 2 out of 3 falls are not seen by anyone who works in the hospital. This tells us that many people are trying to do activities without asking for help or waiting for it to arrive. Chapter 4. How do falls happen? Falls happen because of overbalancing. This is like what happens when a tree falls over. To stop these falls, you can use a walking aid for support and ask and wait for help from a nurse before walking. Also, avoid leaning on your bedside table when walking around your bedside. The wheels underneath can move quickly and cause you to overbalance. Falls happen because of slips and trips. This normally happens on a wet floor or where there is an object in the way. There are several obstacles on the screen now that could cause you to trip or slip if you were to try to walk past. To stop these falls, look up and down the path that you will walk for obstacles and wet surfaces. If you see an obstacle or wet floor, ask the nurse to remove it before walking past. Falls happen because your legs give way. Normally, your leg muscles stop your knees from buckling beneath you. However, they may not be able to do this if you have had a stroke, recent surgery, or if you have been sick in bed for a few days. To stop these falls, you can use your walking aid, ask and wait for help from a nurse, and do an exercise program given by your physiotherapist to strengthen your legs. Falls happen because of dizziness, becoming lightheaded, and fainting. Hospital patients can feel lightheaded or dizzy if they try to quickly get up out of bed or a chair. This is often related to changes in blood pressure. If you experience dizziness like this, get up slowly from your bed or chair. Tighten and relax the muscles in your legs 5 times before you get up. Here you can see David straightening and bending his legs to move those muscles. Dizziness and fainting can also be caused by other problems. If you experience any dizziness, lightheadedness, or fainting, make sure you talk to your nurse or doctor about it. Chapter 5. Could I fall over? Very few people think that they will fall over while in hospital. Take some time now to think about whether you think you will fall over while in hospital. Many people do fall, including the people who did not think that they would fall. Everyone who is staying on a hospital ward like yours is at a higher risk of falling than usual. Being ill, having surgery, or having other treatment can make you weak, unsteady on your feet, and less able to think clearly. The hospital is also a different environment to what you are used to. All of these things can increase your risk of falling. Chapter 6. How can I stop falls and have a safe recovery? The easiest way to have a safe recovery is to always follow the 3 simple steps to stopping falls. 1. Know if you need help to get up and walk around. 2. Ask for help. 3. Wait for help. Another approach that might help is to plan ahead using the following activity. Imagine that you were to have a fall while in hospital. Take some time now to think about this. Where do you think you would be most likely to fall? In a passageway? By your bedside? Near the toilet? Or in the bathroom? Or somewhere else? What time of day do you think that you would be most likely to fall? Around breakfast? Lunchtime? Dinner time? Or at night time? What do you think you would most likely be trying to do if you were to fall? Remember, most falls occur by the bedside, either in the morning or afternoon, and that 2 out of 3 falls happen when a nurse cannot see the patient. Now think about what you can do to stop this fall from happening to you. You can write down these things that you think you can do to stop yourself from falling over while you are in hospital. From now on, we will call these things your goals for a safe recovery. Here is an example that might help you. David thinks that he might fall over when trying to go to the toilet in the morning. He knows that he often needs to go in a hurry, but that his walking is a little unsteady even with his walking stick. He has also noticed that the nurses can be very busy in the morning. David decides that he will talk to his nurse today about his risk of falling over while walking to the toilet. He decides that he will press his buzzer 10 minutes before he needs to go to the toilet. He will do this in the morning especially because he knows the nurses are busy then. He decides that he will wait for his nurse before walking to the toilet and that he will use his walking frame to get there. Now, just like David, think of some things that you could do to stop yourself from falling over while in hospital, and write them down on this page.